Why Cochrane Systematic Reviews are the gold standard and why expert witnesses and attorneys should care. Not all systematic reviews are created equal, and if you're an expert witness and you're citing research in a report or courtroom testimony, you need to be very careful, because the wrong kind of review, either from a weak journal or a heavily flawed source, that can be used to undermine your entire argument. But there's one name that stands apart: Cochrane. Today I'm going to walk you through why Cochrane Reviews are considered the gold standard for systematic reviews and how they can strengthen your credibility as an expert or your position as an attorney. So, a systematic review, it's not just a summary of articles. Sometimes that's how they're described. But what it is it's a structured process to answer a focused clinical or scientific question by searching, appraising, and synthesizing all relevant studies. But let's start with a more basic question. Why would we conduct one at all? So imagine you're researching the best method for debriding surgical wounds. While there's numerous individual studies that exist out there, we'll say 100, a Cochrane Systematic Review is going to synthesize this evidence to provide a comprehensive analysis of the effectiveness of different debridement techniques, for example. And what would be more useful to a policymaker or a surgeon or an expert witness? Adding that 101st trial or study, or pausing to critically examine the 100 trials and studies that already exist? That's the job of systematic review. That's what it does. So the purpose is to summarize the totality of evidence on a particular question, to resolve contradictions in the literature, to evaluate the quality and the risk of bias of the existing studies, to identify gaps in knowledge and outline future research paths, and to guide evidence-based decisions in medicine, public health, and courtrooms. Systematic reviews do not just cherry pick, they clarify. Now let's get back to talking about Cochrane. So Cochrane Reviews, they're internationally recognized as the gold standard for a reason. And here's what makes them so different. So Cochrane Reviews use very rigorous methodology. They follow a pre-registered, publicly available protocol. And so what that means is the authors have to define their inclusion and their exclusion criteria from the get-go. So the criteria that they would use to include one of those 100 trials that we mentioned earlier, or the criteria they would use to toss them and say, we're not going to look at this evidence. They also outline the search methods used to conduct the literature review. So if that was done by a medical librarian or maybe just a researcher, they're going to be very transparent about the search terms they use, the databases, strategies, the time, publication times they looked at, and they're going to have an analysis plan in place before they even get started. So this is important because it means there's no moving the goalpost, so to speak. They don't just start with some key questions and then get in the literature and say, we don't like what we're seeing. We're going to tweak these key questions and we're going to tweak them again. And we're going to kind of make them fit what we see in the literature. No, they don't do that. They have very sound processes that is very strong from the get-go. They also look at team-based and a global approach. So this means that every review is created by a team of experts from different countries and different disciplines. This can reduce bias, and it also helps broaden perspectives. A really important aspect of Cochrane Reviews is that there's no industry funding. So they maintain a very strict rule around no financial conflicts of interest, and that can be critical for high-stakes litigation where bias is going to come under a magnifying glass. You don't want to cite a study that is heavily funded by, pharma. It could be used to kind of pick at that credibility a little bit. There's also something that the Cochrane teams use called the grade criteria. And what this grade framework is it's used to evaluate the certainty of the evidence. It's a structured, transparent tool, and it shows how confident they are in each finding that they arrive at. Cochrane Reviews are also updated very regularly. You could consider them like a living document. They're updated generally every few years, and especially if a wave of new, very revolutionary literature comes out, that will tend to prompt a new review, and they are keeping up on those reviews pretty frequently. They also have very strong editorial oversight. Every Cochrane review, it goes through multiple rounds of editorial and peer reviews. A lot of reviews out there in these lower tier journals, they don't even come close to that, and it shows. One of the biggest reasons the Cochrane reviews are the gold standard is that they prioritize randomized controlled trials. So for questions about effectiveness of an intervention, Cochrane typically includes only randomized controlled trials, and that's because they provide the highest level of evidence. This is especially true for treatment comparisons or surgical outcomes. Now, Cochrane will include non-randomized studies when the question demands it. So for example, if it's looking at cases of prognosis and diagnosis and long-term safety, or in scenarios where RCTs are unethical or just not available, in those situations, the review is still held to very high rigorous standards using that appropriate risk of bias tool for the observational studies if that's what they have to work with. So Cochrane reviews are trusted by policymakers, and they're routinely used for national decision-making bodies in the United Kingdom. So they develop these clinical guidelines and the health coverage decisions for the entire National Health Service of the United Kingdom. So when they put out a Cochrane review, it isn't just like we looked at the evidence, here's what we think of it, and put it out there, and you can do with it what you want. The Cochrane reviews are highly, highly likely to be directly implemented in the United Kingdom's healthcare system. So that's a very large population. It's one of the largest healthcare systems in the world. So because of that, the methodology behind each review, it's got to be rock solid, transparent, and it's got to be very defensible because it's going to affect a lot of lives and a lot of patient care. Now let's contrast this with the US healthcare system, where we have a patchwork and kind of a fragmented system of payers and providers. We have a lot of guideline groups out there and specialty societies, and they offer, a mix of evidence. Sometimes they look at randomized trials, sometimes observational studies, they look at expert consensus, and sometimes they even look at insurance claims data. So Cochrane stands a little bit above that because of its consistent, rigorous approach to evidence appraisal, regardless of the geography. If you're trying to build a report or testimony on solid ground, this is the kind of evidence that you want to anchor it to. Now let's connect the dots to litigation. Whether you're working under Daubert or Fry, your expert testimony has got to be based on reliable methods and generally accepted science. Cochrane checks these boxes. It's peer-reviewed, its methods are transparent, and it's widely accepted in clinical and academic circles. In a Daubert challenge, one of the first things an attorney is going to ask you is what literature supports your opinion. If your answer is, well, I found this single center study from 2007 and its methods are unclear, and someone like me can go in and pick those methods apart and find all these weaknesses in them, you're in trouble. But if you cite a recent Cochrane review that has analyzed dozens of studies and it's applied this really rigorous grade methodology, you're on solid footing. And not just legally. You're also helping the jury and the judge to understand what your conclusions are based on. And they're not just based on personal preferences, they're backed by global consensus and a strong evidence base. Let me give you a real-world example here. You have two experts giving opposing opinions on a post-op complication and same-day discharge safety, for example. The plaintiff's expert has cited a Cochrane review that looked at 25 randomized controlled trials. It concluded that there was a low to moderate certainty evidence showing no increased risk of complications with the same-day discharge for these select patients. The defense expert, on the other hand, well, they cited a 3-page narrative review from a regional surgical journal. Guess whose testimony is truly evidence-based? If I can leave you with one takeaway today, that will be that Cochrane Reviews are the gold standard because they go beyond just reporting evidence. They appraise it, they compare it, and they synthesize it with integrity. And in litigation, that kind of integrity matters. If you're an expert witness or you're an attorney and you're prepping for a case, do not settle for a Google search or a handful of mediocre reviews with a bunch of holes in their methods. Start with the clinical guidelines that define the standard of care, and then check to see if a Cochrane review exists. Cochrane's SRs are rigorous, they're unbiased analysis, and they can give your expert opinion the credibility and strength it needs to stand up under court. Thank you for listening. I'm Michael Graham of Graham Med Legal Research, and stay sharp.